idea with this slide is that there's going to be certain positions of your leg that doctors don't want you to put your leg into after the operation for safety reasons. And really, the precautions that are listed are dependent on your surgeon. So if you have Dr. Danes or Dr. Levitt, you will follow posterior hip precautions, which are these. And if you have Dr. Holly or Dr. Smith, you're going to follow anterolateral hip precautions, which are these, and we'll talk about each one individually. So the first one on posterior hip precautions is Dr. Danes, Dr. Levitt do not want you to cross your legs. So they don't want you to cross over, and that doesn't matter if you're sitting, standing, lying down, or whatever. So if you need to put a pillow or something in between your knees to kind of cue you to keep from crossing, then please do so. The next one on there, do not allow your operated knee or foot to turn inwards. Do not internally rotate. So that is this motion, turning my leg inward like this. Now, when I'm standing here, that really doesn't happen all that much. I don't really worry about doing this because that's not something we do. The only time this becomes a problem is if I plant that foot and I turn my body towards my operated side. So the thing you got to remember is that if I want to turn towards my operated side, I just need to make sure that my leg kind of goes first. My toe is always pointing the direction that I'm going to avoid, not adhering to that precaution. Okay. Do not bend more than 90 degrees at your hip. So don't raise your hip or your knee past your hip when sitting or lying down. Okay. So the 90-degree precaution is the angle between your trunk and your thigh. So this is the 90-degree angle that we're trying to avoid. Going past that, again, is this a problem when I'm standing? Absolutely not, because no one stands like this. It's only a problem when you sit down, because when you sit, you're already pretty close to a 90-degree angle, and it becomes a big problem when I go to get up, because the first thing we do when we go to get up is we lean forward to get our weight over our feet, and now I'm past that 90-degree angle. So the way to avoid that is to sit on a higher surface, or to stretch your leg out in front of you so that when you do go to get up, you don't have to lean so far forward and the angle isn't going past 90 degrees. Okay? And then, of course, don't fall. Like any orthopedic surgery or any surgery at all, you don't want to fall down. When it comes to anterolateral hip precautions, do not overextend your hip. So if we talked about this is hip flexion, then the opposite of that, this is hip extension. So Dr. Holly, Dr. Smith don't want you to reach your leg backwards too far. Again, when I'm standing here, is that a problem? No, it's only a problem when I take a big step with my other leg. Then I go into too much extension with that hip. So how do I avoid that? Don't take a big step with your opposite side. So take small steps to begin with, and as time progresses, you can take bigger and bigger steps. Do not point your toes outward. Okay, do not externally rotate. So that's this motion, going outward. Again, is that a problem when I'm standing here? No, because we don't do a lot of this. It's only a problem if I plant that foot and I turn the opposite direction. So again, the way to avoid that is just make sure whatever direction you're going, that your leg kind of goes first and that your toe is always pointing the direction that you're going to go. That's a way to avoid breaking that precaution. And then don't fall. Last thing that's on this slide that I think is worth noting, because I get the question all the time, how long do I have to adhere to these precautions? And it says here at the bottom of the page, if you have that question, go to your surgeon. They'll let you know the length of time that you need to adhere to these precautions. These are other illustrations of things to avoid. The 90-degree angle for a posterior hip precaution. You can see this is the angle that we're looking at right here between the thigh and the trunk. That one is okay. If you sit on a real low surface, you can see that that's going to increase that angle. We don't want you to do that. And then also bending forward breaks that precaution as well.